Hi, I'm Dr. Stephen Bradley. I'm an anesthesiologist and clinical medical ethicist. Today I'm going to be talking about this new paper. It was released in the Journal of American Medical Association, the October 22nd edition. It's entitled Scientific and Ethical Principles Underlying Recommendations from the Advisory Committee on Immunization Practices for COVID-19 Vaccination Implementation. It's a mouthful, but this article answers a lot of the questions that people have had recently dealing with when this coronavirus vaccine comes out. Who will be the first folks to get it? This article does a deep dive into the organization that's responsible for making these recommendations and helps answer some questions, at least preliminarily, as this vaccine continues to be worked on and prepared for use. So we know that this vaccine's been in development for going on 9 months now, since the onset of this SARS-CoV-2 pandemic. The phase 1 trial started in March, and over about 45 people were first enrolled in that trial. The results are 7 months into data analysis. Since that point, over 25,000 people have been injected with vaccines undergoing research. This has all been directed under the FDA's guidelines for efficacy and safety during vaccine trials. A lot of the research was done pre-pandemic into coronavirus vaccines, so a lot of the blueprints were already present before they started working on this specific formulation of the vaccine. So that's allowed some leeway in the timing and for things to be expedited. The vaccine is still going through rigorous studies to ensure its safety profile. There's two questions really about this vaccine. Number one is, who will be the first folks to get it? Number two is, should I get the coronavirus vaccine? So unfortunately, I don't have a good answer for that. The ultimate decision is made between you and your primary care physician. You sit down with your healthcare provider, you talk about your own comorbidities, those are the medical conditions that you have, your past medical history, and your medical records, really. You talk with your physician and determine what the risk and benefits presented to you, and from this vaccine, is this the right decision for you to make? And that's once the vaccine is actually cleared for administration. A lot of folks are worried about, lack of transparency, and is this another Tuskegee experiment, as we recall from our nation's sordid history, where ethnic groups and minorities were used to practice on, to run clinical trials on, to study essentially, unbeknownst to them. They're taken advantage of significantly. And a lot of folks are worried that this could be another case of that happening, where ethnic minorities are experimented on with this vaccine, and a lot of people are hesitant to receive this virus. I would caution those that might think that, because to some degree we have learned from our history and we have made strides in promoting equity in healthcare. We still have a long ways to go. But fortunately, with the development of this vaccine, there are Black and brown folks on pretty much every stage of development. I follow this Dr. Kizzmekia Corbett. She's one of the leading researchers that's been working to develop this vaccine, and she's at the National Institutes of Health doing amazing, incredible work to ensure that this vaccine, number one, comes to fruition, and number two, is ethically administered to folks, and nobody's at risk more so than the other. The workforce is more diverse, and this diverse workforce helps provide more transparency and a measure of safety for underrepresented minorities in healthcare, as well as in the population that suffer from these healthcare disparities that we know all too well exist. So I don't have the answer for if you personally should receive the coronavirus vaccine when it is available. However, the question of who will be the first to get it is somewhat answered in this paper that was recently released. I want to go to actually the last line in this paper. This is in their conclusion statement. It reads, "The Advisory Committee on Immunization Practices will make recommendations for the use of licensed COVID-19 vaccines based on ethical principles, scientific evidence, and logistical feasibility, using a transparent process that puts safety first." You could tell by that sentence Number one, they give you the ideals with which they're working to provide this vaccine to the public, but it also shows that they don't have a hard and fast answer for who gets this vaccine and when it will be available. And that's because they're going to withhold their formal recommendations and opinions until they have a vaccine that's passed the stage 3 clinical trials and is vetted by the FDA and available for release based on emergency use principles, but we don't have anything that's available right now. So when that happens, there'll be enough data to weigh risk and benefits and determine who should be getting this vaccine first. But in this paper, they do lay out some guidelines and tell us with some transparency how they will make that decision. Since June of 2020, so June of this year, the Advisory Committee on Immunization Practices, they've held 4 public meetings to lay the groundwork for the public health protocols and recommendations that they'll use in recommending how this vaccine is administered. They talk about the ethical principles that they're going to focus on and the potential groups that they're going to prioritize for the allocations of these initial doses of the vaccine, which are going to be in limited supply, understandably so. And again, they're going to issue these recommendations after reviewing the safety and efficacy data, and the vaccines are licensed or authorized under emergency use authorization by the Food and Drug Administration. Now, who is the Advisory Committee? The Advisory Committee on Immunization Practices is an independent federal agency, an independent federal advisory committee, rather, that is composed of experts that are outside of the federal government. They're from a diverse medical and public health background. There's also some consumer representation, so the lay public is represented by this council. And this group discusses and provides recommendations to the Center for Disease Control and Vaccine Use in the U.S. civilian population. If and when improved, these recommendations become the Center for Disease Control recommendations for how these vaccines are administered. These recommendations from this group are used to determine which vaccines are available for the Vaccines for Children's program, which provides vaccines to children that are underinsured or have no insurance. They also provide recommendations for the vaccines available to those on Medicare, Medicaid, and receiving vaccines through their employers under the Affordable Care Act. So their recommendations are not binding. However, they do determine how vaccines are used in the public sector, and this then sets the standard for clinical practice in the private sector. So in September of this year, the Advisory Committee on Immunization Practices, they endorsed 4 ethical principles with which they will make their recommendations. They seek to, number 1, maximize benefits and minimize harm. 2, use equity in determining how this vaccine is administered. Incorporate the tenets of justice as well as fairness. A 5th principle that they mentioned was transparency. So they want to be transparent so people can see exactly how they're coming to these decisions. And this is essential to building the public's trust in this organization. So when it comes down to who gets this vaccine first and the initial doses that are going to be allocated, they recommend kind of 2 phases, a phase 1A and a phase 1B. The first phase is going to be this period where there is a very limited supply of the vaccine, and they're going to need to target administration to specific populations and people in which this vaccine is most needed. During the second phase, the supply is going to continue to increase, and they can then broaden out who else is receiving this vaccine. There's still going to be somewhat of a selective process for that because some people are still at higher risk than others. So this organization reviews the allocation schemes, and they apply these ethical principles to define which groups are considered for these first couple of phases. They looked at certain scenarios, and again, their formal recommendations are pending the completion of clinical trials. They mention the phase 1 and the phase 1B. So phase 1A would be healthcare personnel. They made sure this includes both paid and unpaid people serving in public health care settings with the potential for direct or indirect exposure to COVID-19. The examples they listed include people working in hospitals, long-term assisted living homes, home health care, pharmacies, emergency medical services. So the EMTs, paramedics, those folks that are truly on the front lines being exposed to people as they seek to render aid. Obviously, the reason for doing this is that healthcare personnel are essential for ongoing COVID-19 response, as well as the response to the flu season and other medical emergencies, because they didn't stop just because of this COVID-19 pandemic. So these folks are responsible for these folks are responsible to respond to these crises, and they are at high risk for exposure to COVID-19. The next phase would be this phase 1B. This is going to occur when more doses are available, and then there's a possibility that there's multiple options for a COVID-19 vaccine at this point in time, because there's multiple companies doing this research and producing different formulations of the vaccine that are being tested and vetted. So at this point, we should have additional options for vaccination, and they're going to look at folks that are essential workers, folks that are living with high-risk medical conditions, and the elderly. And they define each of these groups a little more in this paper, including the essential workers. They're defining them as a group of up to 60 million people who are working to provide critical infrastructure to our nation, including food and agriculture, transportation, education. And they also go ahead and note that racial and ethnic minorities are disproportionately represented in these low-income essential worker roles. So they're estimating that up to 60 million people that would need this vaccine during that second phase. They mentioned that up to 100 million adults in the US have one or more high-risk medical condition that predisposes them to worse outcomes if they contract COVID-19. They're hospitalized and have worsened outcomes. So these folks would also be included in that phase 1B rollout of this vaccine. Between the phase 1A and 1B, there is an estimated approximately 200 million people in these groups. So vast numbers that are going to need this vaccine in the first couple of scheduled rollouts. One of the things that we don't know, and we won't really know until we have a lot more data, is the implementations and the characteristics of each of these licensed vaccines. So these vaccines are going to have different parameters for handling, for storage, different strengths and weaknesses, and some will work better than others. Some will be better indicated for certain people with different comorbidities or the lack of certain comorbidities. We won't know the storage and handling requirements, the number of doses required, and ultimately, as we roll out, by we I mean they roll out this first wave of vaccinations, this will set the tone for what follows. If people get the vaccine and don't do well, then subsequent administrations aren't going to go so well. So it's a very high stakes game, for lack of better words. Again, the initial recommendations for the vaccine will be influenced by the terms of the Food and Drug Administration's approval. For every licensed vaccine, the effectiveness and performance may vary in particular populations. This then affects the risk and benefits to that population. Of note, they haven't really studied these vaccines in children or in minors, so that remains an unknown as we proceed down this path. So the Center for Disease Control, healthcare facilities, state and local health departments, they've already begun to implement planning and as for how they will roll out this COVID-19 vaccine. This planning will rely on this advisory committee for immunization practices. However, they're still pending those recommendations until the phase 3 efficacy and safety data are available for review. This paper ends by some rather strong wording that there is a clear consensus that the initial doses should be used to vaccinate healthcare personnel, and the committee makes recommendations for future uses of the licensed COVID-19 vaccines based upon the ethical principles that they mentioned previously in the paper, based upon the scientific evidence that we currently have and will continue to develop and extract, the logistical feasibility of distributing these vaccines. And however, they do commit to providing a transparent process that continues to put safety first for all those parties involved. So definitely, if you can get a hold of this paper, check it out. Again, it's in the October edition of the Journal of the American Medical Association. Really, really, really good resource, and provides a fair amount of transparency onto how this COVID-19 vaccine will be released whenever it is available. If you want more information on the development of the vaccine or an up-to-date resource for how we're doing with the COVID-19 pandemic, the SARS-CoV-2 virus, the pathology, pathophysiology, I would defer to my guy, Dr. Jamie Rutland, Dr. Jay Rutland. He's got an incredible YouTube channel where he breaks down all these different principles in immunology and how our bodies are affected by SARS-CoV-2, and he can answer those questions for you. I'm more of a ethicist. I'm just a simple country anesthesiologist, but I love medical ethics and being able to break down these concepts and these principles. So if you enjoyed this, go ahead and subscribe to the channel, hit a like, share with somebody who's curious about when they may be receiving this COVID-19 vaccine. I'm hoping to post quite a few more videos on medical ethics, especially related to COVID-19, as well as other ethical considerations for those in healthcare, as well as posting videos of my podcast, the Black Doctors Podcast, which seeks to increase diversity and representation in the professional field. And finally, Ask an Anesthesiologist, in which I'll answer questions about anesthesia, about the roles we play from day to day, the process for medical students and residents seeking to go into the field. And I'll talk about my job as an anesthesiologist in the United States Navy and what it's like, how it's different from those that practice on the outside in the civilian world. Thanks for tuning in. Thanks for watching. Again, I'm Stephen Bradley, your friendly neighborhood anesthesiologist and clinical medical ethicist.